Okay, so like I said, I'm Meg. This is Alex. And then I guess I'll just introduce you guys by name, but it makes more sense for you all to tell a little bit about yourselves, your background, where you work, and what your organizations do, and things like that. So I guess even if you just want to introduce yourselves, you can take a few minutes.
Everyone does that every panel. Okay. Hi, everyone. Good evening. I'm Aamina Morrison. I am the Health Education Coordinator for the Trans Health Information Project. It is a program of Prevention Point, Philadelphia. We are located in downtown Philadelphia on 12th Street, Westfield Market, and Chestnut, 21 South 12th, 10th floor. I forget what suite it is, but you can't miss us. We're the only other office other than that annoying place with the nurses. So that would be us. But we specialize in all kinds of transgender issues. So it's not necessarily a one-stop shop, but they can definitely come to us for just about every referral under the sun that relates to some sort of trans-related or gender variant-related issue. And what I mean by that is that there's not too many places in Philadelphia that actually have an open space for people of non-gender conforming spectrum to be able to come and have, a free space and safe haven. And we provide that for them as well. So we have all kinds of support groups going on. There's free HIV testing, there's counseling, there's CRCS, there is, we have a clothing bank, we have referrals to food banks and all kinds of different resources. We have social events at the end of the month, Print and Pampering Day for the girls, for our fellas that are over the age of 21, we take them out and everything, or we go to like bowling parties and stuff like that, things that are just kind of, just for everybody to have fun. But we just try to provide a safe and comfortable space for them across the board. So that's what we do. I guess I'll get to my personal stuff later.
Yeah, sure. I mean, it'll probably come up in questions we have or whatever you guys discuss.
No problem. I just like to know my cue.
Yep.
My name is Phantazia Washington. I'm a youth trainer with the Addict Youth Center. Basically, the Addict Youth Center provides different services for youth 14 to 24 or 23. Different groups, after school groups, referrals, free healthcare, free counseling, and a lot of different services for youth. And what I personally do is work with the Morrison Institute, another organization working with the Addict Youth Center inside of the Addict Youth Center, and they go out to different organizations, faith organizations, foster care, pretty much anywhere that'll have us, and talk to them about LGBTQIA issues, and just try and educate more people.
Hi, I'm Max. I'm on the panel tonight instead of Jose DeMarco from ACT UP because he had a health issue to deal with. He's fine, but he can't be here tonight. And I am also a volunteer with ACT UP Philadelphia. We're an all-volunteer organization that we do direct action to end the AIDS crisis through direct action, which to us means confronting people with power directly, whether it's going to their office in a lobby visit or going to their office to do civil disobedience. We'll do what it takes to end the AIDS crisis. And specifically in Philadelphia, we're working on a housing campaign because of the huge lack of affordable housing in Philadelphia and the ways that that's contributing to the AIDS crisis here.
So we just have a few questions from us, and then we'll open it up to the audience for you all to ask some questions.
So I guess this is pretty broad, and you guys can approach it however you want. But the film is composed of like lots of little stories of people, these sort of small emotional truths, and I think that they kind of provide a sort of conversational starting point. Because things may not be relevant to everybody, or there may be bits and pieces. So I wanted to ask just more generally, what are sort of specific issues that queer, and or trans and or youth individuals face, and how are those both, how do they both interact, and how are they both kind of explicitly different, I guess, if you can help sort of elaborate the dimensions of problems that people are faced with.
Yeah, they are. Okay, so I'm going to speak from many levels. So naturally there is, similarities and differences, with the problems that queer youth face, especially, especially here in Philadelphia. There's a lot of elements. There's the whole, people thinking that, that queer youth have chosen to be in the situations that they have been in, because it's like, okay, well, if you could have just, acted a certain way or pleased your parents by doing X, Y, and Z, then you wouldn't be put out, and all. Like, I've heard all kinds of stories from people, because it's not like we turn people who are non-trans away at the door when they come to us. We pretty much talk to everyone. So I've heard all kinds of stories, and it's like, I guess we kind of just, we take it in, like we take the stories and stuff that they say, but it kind of makes me sad, because I can't believe that even now in 2012, that we're still kind of going through the same sort of motions with people saying like, well, can't you just be something else? Like, can I not wear a purple shirt on Tuesday? It's like one of those things. It's like, like you really need, like they need a lot of things, and they come to me like, I wish there was this, and why don't these things exist, and why don't these things exist, and we want this, and this should be a one-stop shop, and we should be able to live here, and and build a big home, and all of those things are great, but I can't win the lottery like right now, because if I could, I would be able to do those things. I kind of don't want to wait on my government, local, state, or federal, to finally, come up out of their pockets and make safe havens, for people of, of our spectrum, of community. I would like to do these things myself. Like, I would like to get up the next morning, have the funds, and do it right now. I mean, because they need counseling around how to talk about safer sex to their, current partner or sexual encounter. They need, certain tools on, when is the right time to come out to your parents? Because, what, truth of the matter is, you don't have to tell them. You don't. And I've seen it, turn out really nice. And then I can look at my own personal experience, and it was really hard. And I related to each and every one of the stories that I saw. And this isn't the first time that I've seen this documentary. I can relate to all of it, from the drug use to the prostitution to the disrespect, to people, belittling you because you are trans, not really understanding who it is that you are, but often letting you know what they think that you should do with your life. In the process, you're not receiving service to very relevant things that you need right now. I would like all of those things to be here. And I think that the only way that we can do that as a community is to make sure that we can do that, for ourselves, because we can't wait on anyone anymore. We could yell at our government. I mean, hell, we could throw shoes, no pun intended. But it's like, is that really going to get anything done? Or are we just going to be, angry queers again? No. Like, we just want something for ourselves. We want to make sure that there's a physical home for the home that we have within our community. And that's simply all that the youth are speaking about. Like, everything that they need right now are things that we needed. And I want to be able to give that back to them. I hate that I cannot do it to the capacity to them needing it and me giving it to them. I hate that.
I believe that the key difference is probably support and resources. There's a huge amount of resources for LGBTQ youth in the city, but a lot of them are queer resources. And I think a lot of the times when heterosexual kids are going through things and they have problems and they have issues, they have abusive households, or there's such things, a lot of times they can go to their counselors, they can go to their teachers, but a lot of times as a queer, LGBTQ, anything, as a youth in that situation, you're confronted with you have to out yourself to tell somebody what's going on. To say, hey, I need stable housing, you need to say, I was kicked out of my household because I'm gay. And a lot of times, if you were kicked out of your household because you were gay, that as a child is teaching you the lesson that people aren't going to accept you because you're gay. So learning that lesson and then having to go to somebody else and say, hey, I'm gay, can you help me? That's scary, because the last person you told you were gay said, no, you can't stay here because you're gay. So going to somebody else and trying to out yourself and continually having to out yourself just to get the services that you need is extremely difficult. And a lot of times there's a kind of, it's like two different worlds. There's the gay world and there's a straight world, and a lot of times, especially for youth, it very much seems like that, and they feel as though they have to live inside of this gay world just to receive the help that they need, and they feel isolated in that world, and they also feel like they're not going, they almost, it almost becomes like this heterosexual stigma of, well, I don't know if I can tell this straight person this, or I'm not sure how they'll feel about this because they're straight, or I perceive them to be straight, or I perceive them to be a certain way because that's the only experiences that these youth have had. So I think that that's a main reason for a lot of symbolism, stickers and things like that they tell people to use, because more youth need to realize that there is support from not only just the gay community, but the world and the straight community as well.
As an activist, we like to think about numbers and facts a lot so that we can confront people with them. So when ACT UP started our housing campaign 3 years ago, one of the issues that we looked into was youth homelessness, because of the ways that homelessness, especially among young people, is a real driver of the AIDS epidemic. I mean, you could see in the video that the kids in the shelter were going into sex work for survival sex, which is a position where it's really hard to negotiate for safe sex because you're just trying to negotiate for a place to spend the night. The needle use and access to clean needles, all those things tie up really closely with homelessness and with HIV rates among men who have sex with men and trans people of color as much as 50%. Any kind of risky behavior becomes really dangerous. So we started looking into what's the housing opportunities for young people facing homelessness, especially LGBT young people. And there's basically one shelter for kids under 18. There's no beds, and it's run by Catholics, and they can be pretty rough on LGBT kids. There's now the foyer. I don't know if they have beds yet.
It's done. It was just a winter emergency shelter.
Okay, so there was a winter emergency shelter, but so those beds aren't there anymore. And I think there's a drop-in center with pretty late night hours at Broad Street Ministries, but it's a really small number of beds for a really large number of kids, and not in an ideal situation. So just one thing that needs to happen in the city for some of the problems in the movie to be dealt with is there just needs to be more beds, and the beds that there are there need to be accessible to everybody. They need to not be in private shelters, but be in situations where people have the protections that our public shelters have. Because folks under 18 can't go to the city shelters. It's a liability. It's not okay for them to do that.
So you were just talking about how using needles and practicing survival sex, how all of those tie into HIV and how those are all also often intersecting with homelessness. And I was just, I guess my question is if you and other panelists could talk about how housing is a public health issue.
Sure. I'll start this time. So some of the things I just said in terms of folks are more likely to get infected when they don't have access to housing, and there's just data that shows that. It makes sense, but then also they've done the studies to find it out. The other thing is people are much less likely to transmit the virus when they have stable housing. And the biggest reason for that is for HIV in particular, the medicine that you need to take is really specific and complicated, especially if you've developed any sort of resistance. They now recently have somewhat easier therapies, like even 1 pill a day, but it's still, you have to take it at a certain time, you have to take it with food, it has to be refrigerated. When you're in a shelter system, it's really hard to get access to your own medication. It's not what they're legally supposed to do, but it is what they practice, is when you go into the adult shelter systems, they take your medications from you. And it goes into this big cabinet, and every day you have to line up at the time that they're giving out the medicine and say, these are my medicines. So A, you have to disclose your status. B, you're taking it on someone else's schedule, not the schedule that your doctor's prescribed for you. And C, people have had issues with losing their medicine being stolen. They try and keep it rather than turn it in, and it gets confiscated. If you miss even 1 dose, maybe 2 doses, you're really likely to develop resistance. And your viral load goes up. So people's doctors actually tell them, look, if you're not stably housed, I don't want to start you on medication. You have a high viral load, you have a low CD4 count, you're getting sicker, but it would be worse to give you the medication that saved your life and face you getting resistance. So people need housing to take their medicine. When they take their medicine, the viral load count goes down, 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 and they're not shedding the virus, and they're so much less likely to transmit it. This year, the study came out, and it was done in Africa, but when they had couples where one was positive and one was negative, and they were sexually active, those where the partner who was positive was on antiretrovirals, they were something like 96% of them didn't pass the virus. I mean, that's huge. That's like more better prevention than condoms. It's the best prevention out there is to be on medication. And if you're not housed, you can't be on medication. So that's why just for HIV, housing is part of public health, it's part of treatment, it's part of prevention. None of those strategies work without getting people housed.
Like you were saying, in addition to housing, just primarily a lot of times people that don't have housing don't have health care. And if you don't have health care, there's really nothing that you can do for yourself. If you do have HIV, you can't get access to those medications, you can't get access to any of the medications, whether they be psychological, physical, even flus, things like that, when you don't have access to health care. And the number of people that are homeless that don't have health care is just astronomical. So it's that in itself is one of the main problems, is the inability to even get health care or get those medicines that you need constantly, because where free clinics do come in and they do help for certain immediate issues, there's co-pays. There's things that homeless people, the homeless population, homeless youth especially, can't always make a decision between if I need my medication or if I need my meal. That's all.
Oh no, what they said. No, it's just like, this is the kind of stuff that this program is, constantly fought for, through the, almost 9 years that we've been, in service and active. These are the same things that we've talked about in every state, in Atlanta, in Seattle, in Detroit, in Chicago, going to different, health planning coalitions and everything, like just talking to them and helping them understand that, that this is a serious crisis, and it still is, because, not only it's just a disservice altogether. If you don't have a place to live, then you pretty much virtually don't have access to anything that can keep you alive, unless it's some sort of survival, yeah, so what they said. I can't even top that. That's exactly what is going on right now.
What are some of the local political conditions specific to Philadelphia that may make the situation here different from what was, in the film? There are a lot of, in many ways, there are a lot of great services and resources for trans people in Philadelphia, but there are lots of things that the city can do better. So
I would love to take this. I couldn't wait for someone to ask this. There's a few things that the city could do to make things a little bit easier for people who are in desperate need of resources that are very important to them, like healthcare and medicines and housing and support and people to talk to. We don't need an ice skating rink. We need, more housing, and resources available to people who need it. We do not need a casino where the gallery currently is. We need healthcare that is accessible to people across the board. We don't need anything revolving around the element of entertainment or pleasing people coming from other places just to visit this place as a tourist site. We need to put our monies into the rebuilding and the rehabilitating of the people who are in need in this city. What I'm tired of is turning on the TV and watching the news and listening to a certain mayor of ours talking about how many other millions or billions of dollars is going into this new project that no one needs and no one will use, while people continue to come into my office and into her office and coming to Max and constantly coming to us with the same situations and the same problems and the same issues that are affecting them right now, and we have almost little or no resources to be able to help them because, well, I just watched the news this morning, and so much for asking City Hall for some money to, make things actually work in the city for the people who will appreciate it. And that's just my take on it. I could be wrong. Maybe we need a casino or an ice skating rink. I just don't see when the hell that is. I don't ice skate. I don't gamble. I know how to make my own clothes. We don't even need another mall. But we need our places for our youth to go, as well as our homeless adults. There's a desperation right now for a lot of things, and it's not like we don't have the money. Like, I guess that's what my biggest problem is. And this is not just here locally, this is our nation. It's not like we don't have the money. It's just they don't want to give it to the people that need it. They don't want to give it to the cities that need it right now. And that's pissing me off. I can't say that eloquently. It's pissing me off.
So all of that, first of all, all of that.
Because I'm pissed.
No, I mean, that's absolutely fact. It seems like they just keep taking money from the places that need it and then putting it into the places that don't, and it's just confusing me. I know organizations that are getting their HIV funding cut. I know a huge amount of nonprofits that are being closed. I have friends that are being laid off, and these are very, very, very important things. But there are continual entertainment built. There's these casinos and things like that, and I just think the city just really, really, really needs to reassess where they're putting their money, and that's not even necessarily an LGBT issue. That's just an issue of just services and an issue of humanity at this point, and it's just becoming a really big issue in the city.
And part of Philadelphia's problem is that it's in the state of Pennsylvania. So New York City is in the state of New York, which has a Department of Public Welfare that has helped get housing for people, and specifically for people with AIDS. In New York, if you have an AIDS diagnosis, you're guaranteed housing, at least a single room occupancy. You never have to spend the night in a shelter. The city will put you up in a hotel, not a fancy hotel, but a hotel until you get a house, because it's so dangerous to be in a shelter with a compromised immune system. And they use Department of Public Welfare money, state money, to do that. The city of Philadelphia is in the state of Pennsylvania, which has Governor Corbett as the governor, and he is just decimating the Department of Welfare's budget, trying to kick people off the welfare rolls, doing really sort of horrendous things to bump people off and making it impossible to reinstate them. One thing that you may not know about Governor Corbett and his budget is the city of Philadelphia has managed their own federal welfare money for behavioral health, so people dealing with mental illness and addiction. And they've done a really good job of managing that money. They've put a ton of it into prevention so that they can reach more people and more cost effectively than having to put it into treatment when things mess up. So they're finding people and taking care of them and getting them connected to services. They've saved so much money through those good management that they're starting new programs and reaching more people and hiring more case managers, because they keep the money that they save by being good money managers. Corbett has said that starting in the next budget cycle, he's taking half of that cost saving back to put into the state. So the city's good practices that they used to use to expand and reach more people and save more lives and save more money, Corbett's now taking back, in addition to cutting the base budget. It's just awful. Like, it's not even good Republican politics. It's just stealing people's money. So that's one problem that Philadelphia has, is we're in Pennsylvania. And so anything you can do to help Corbett realize that his budget is killing people is a good activist step to take. The other thing is that, like the other panelists were saying, we're not doing a good job of prioritizing how we do spend our money. But there are a couple things that we could do better that are pretty tangible. So like other cities like Chicago, New York, San Francisco, Los Angeles spend some of their own city money to meet the gaps that aren't filled for housing for people with AIDS. Philadelphia doesn't do that. We only rely on federal money, and we actually have one of the biggest burdens, one of the most unmet needs of any city. So we could be putting our own money into that, which we're not. Another thing we could be doing is, I don't know if you know the campaign to take back vacant land. They're trying to consolidate all the vacant land in Philadelphia into one single trust, and have people in neighborhoods have say over how vacant land gets used, so that it doesn't automatically go to developers, and so that when that vacant land does get developed, the money from that goes into the city and it's centralized instead of being sort of scattered and no one knows who's in charge of it. And if you have a vacant lot next to you, you don't know how to get it to start a garden in it, but the developer down the street knows how to get it to build housing that you can't afford. And that's actually, there's a bill in committee right now that could go into city council, and so they need petition signatures of people to show up at city council meetings to make sure that good policy gets into place. Other things that we could be doing are, when big developers do come in, like in my neighborhood at 50th south of Baltimore, there's this big Apple storage that's a big empty building, and they're developers who want to develop it, but every apartment that they're talking about putting in is way out of the price range of that neighborhood. Folks who own their houses in that neighborhood say that's going to drive up our property tax. Folks who want to rent in that neighborhood say, wait, I'm not going to be able to live here anymore if this is what the rent becomes. So you can have policies that say, hey, look, anything you develop, you either have to put money into affordable housing or you have to put affordable units in there right next to the units for rich people. And the city doesn't have a policy for that, but we could. And this is the time to start working on that one. So, oh, and then the other thing is institutions like Penn, which are, right, so Philadelphia is a city with great big nonprofit institutions in it that use land like for-profit institutions, right? They make money off of how much land they have. But that land, if there's classrooms on it, they don't pay property taxes on it. They use the city's fire services, they use the city's water and whatever, but they're not paying property taxes. And so that's a lot of land that the city can't collect taxes on. In other states, those big institutions like Penn and Drexel and Temple and the big hospitals pay in payments in lieu of taxes. So they used to pay that in this city. They used to pay $10 million. They raised some public housing and local neighborhood housing over where the science corridor is now, and they promised, we're going to make a great big trust fund for the neighborhood. And then they didn't. So there's some money that some of the big institutions are sitting on that could be going into affordable housing in the neighborhood. So there are places that the money could come from. It's not like there is no money.
This is kind of a what-if issue. So, for question, if you did have all these resources, like what would like an ideal safe space for queer and trans youth look like in your imagination?
Let me dream about it a little bit, and I'll tell you 30 seconds, I promise. Okay, I don't need to. What would it look like? It would be huge. And it would be for everybody. It just would. Counselors on site, some of them would live there. Doctors on site, some of them would live there. No, I'm serious. Like, have their own spot up at the top floor. And, just testing everywhere and testing for everything. Educational classes, teachers on site. Teachers from different schools so they can see people like them from high schools and middle schools that they used to go to. People who are just friendly across the board for every spectrum of this community. I guess a safe place for the parents to go to talk about some of their issues with, dealing with, with children. Because, they need somebody to talk to too. They need counseling, right? I never asked. But, I just feel like if it were to look like anything, people would be able to walk into that facility and say, this is what fair looks like, everyone. If you haven't noticed, if you've never seen it and been able to touch it, if it's never been tangible, this is what fair and all-inclusive looks like. And it would be just that. It would be just that. It would be for everyone. There would be different wings for different people, and there'd be this huge lecture hall for everybody to come together and get to know each other. There'd be meet and greets every, first, Sunday or last Saturday of the month or something. Just something to just get people back on the bandwagon of what harmony is. Helping people kind of understand that, we all live on this one piece of rock for a reason. I don't get why people think that they should have their own piece of land for their own opinions, because that does not exist. And there should be a sign on the front of the facility that says, if you have a problem with the way other people live here, kindly find a planet that accommodates you and be fair. Let us know where that is. And if there is affordable resources, so that we can go there also and find a planet of our own. In the meantime, you've got to live here with us, because we've definitely got to live here with you. But it would be what fair and what all-inclusive looks like. Because I had a lot to say. It is their
I think an ideal safe space for me would be if somehow I could just go into the mind of every American, of every citizen on this planet and just erase homophobia and erase transphobia and pretend like those things never existed. Because I think, like I was saying earlier, a huge issue for me is just this separate world idea, and I don't want to put LGBTQIA people in this bubble. I don't want them to have their own country or their own planet. I want us to be able to live together. But the issue is that a lot of people are just filled with hate and ignorance. And I think that the only way for it to really be a safe space is that if it's inclusive of everyone, straight, gay, everyone.
I don't really have anything to add except that I know for me, coming up, one thing that I really wanted was lots of free clothes.
Yes.
Because like, what I was presenting as was changing on a daily basis, and it was just expensive to keep up with that. And just lots of clothes and lots of laundry, so that you can present one way for one thing and another way for another thing, and try it on and see what's going to work for you.
And the good laundry detergent, Gain, where your basement smells like Mountain Fresh, would be awesome. And cake, there would be a lot of cake.
Cool. We'll open it up to people, so if you guys have questions or comments, or if we want to discuss, I think this is small enough, we can talk amongst ourselves, so. Don't be shy.
Thanks a lot, it was great, and just wanted, I guess my team maybe covered this a little bit, but I was curious, since this campaign's been going on for like 3 years, what kind of, what have been the main goals for this campaign, and sort of what's in process, and also just maybe other kind of efforts, like you mentioned this emergency shelter over the winter, like what are the kinds of, both for, affordable housing, but also for shelter space, what kind of initiatives have been going on recently, or are going on now?
I'll talk about the ACT UP campaign, and then y'all might know more about the shelter stuff. So we started 3 years ago with the goal of ending the waiting list for AIDS housing in Philadelphia. That's the housing opportunities for people with AIDS is federal money, and they fund all the money for housing for folks with AIDS. And there have been as many as over 200 families on that wait list at one time. If you're actively homeless, like on the streets, can be 6 months to wait. If you're not actively homeless, if you're just paying more than half your money in rent or something, then that can be 2 years or more that you're on the wait list, which is a really long time, especially if your doctor's saying, I'm not going to put you on medicine until your housing stabilizes. So we want that wait list ended. That would take about $3 million a year in new funding, or funding that comes from cost sharing and other sort of smart ways to think about money. Where we've gotten with that, we have some new beds specifically for people with AIDS. There's 20 new slots on Pathways for Housing that are specifically housing first, meaning you don't have to be sober to get into the program. You don't have to be in treatment for mental illness. You can get a house first and then start working on sobriety, which, as you saw in the movie, is a big deal. The young woman who was trying to get clean, it was hard for her, partly being in the shelter and having nothing to do during the day, nowhere to go. So we won those 20 new slots. Those would not have been funded without ACT UP's pressure. We also got the city to apply for an AIDS housing grant that they wouldn't have applied for. They didn't win, but some of the coalitions and partnerships that came out of that grant are what got the new slots. We also won, the city's going to have a new compliance hotline for folks in the shelter, so if you are in a shelter and someone's mistreating you for any reason, you can call and reach a person 24 hours a day who will log that complaint, and it'll get on the desk of the health commissioner, Don Schwartz. We've changed the waiting list eligibility, so you don't have to be quite as sick to get on the waiting list. You don't have to be sober for 6 months. You can just be in treatment. It should be that you're on the waiting list no matter what, but we haven't won that yet. And then we've also gotten agencies to start coordinating that had never coordinated before. So they just did a big survey of homelessness. It's actually going on nationally. It's like 100,000 beds or something. They want to find who's like the sickest out there on the street, the most in need, and get them housed. And as the city came together to do that, they started to realize behavioral health knows about some folks who are HIV positive that the AIDS Activities Coordinating Office doesn't know about. So there's beds for them that they could be getting into with different funding streams. So they've started to coordinate their resources more. They're actually moving some folks off the waiting list, doing what they can with the money that they have. What they need now is an infusion of cash. So they need those extra $3 million a year to start getting people into houses. One thing that's going to happen that's interesting is when we get folks in houses, the state is going to save a lot of money because people won't end up in emergency rooms. The state hasn't said that they'll share that money back to Philadelphia to help increase the amount of housing, so that's another battle that we would like to win. But so right now we're fighting, working with City Council and fighting the City Council to find some new taxes or fees or new ways to get money, developers fees or whatever, to get that extra money into the budget for housing, and then also to figure out how we can use the cost savings that are going to happen across different agencies and coordinate them together and say, look, it's housing that's causing that, let's keep funneling our money into housing.
I don't really have too much for the shelters. There's not
Yeah,
really a lot going on.
There are 3 youth-specific shelters that I know of that our folks from the attic go to in Philly, and it's Covenant House, Valley Youth House, and Youth Emergency Services. And without speaking to any particular one, not naming any one, there are universally really challenging experiences faced by our youth there. And it's across the board, whether it's where young trans girls sleep, whether it's how they're referred to, the pronouns, whether they're sexually assaulted on a regular basis. And they had a foyer for just the winter, but it was all volunteer staff. It was not city funded. And they were, I believe it was only 3 months total that they were able to keep it going in donated space. So I think it's, from what I understand it, it's a void of initiatives. It's based on the resources that we have, or we know of.
There's of course the Major Morris House for trans women in recovery, but I don't think that is necessarily youth accessible. They have to be over the age of 18. So it's just a lot of gaps there, and it's just evident that more things need to be done.
That was a big win though. Do you want to talk about that?
Absolutely. So we are currently working with the Major Morris House. If no one is familiar with Major Morris and how this all came about, she was a trans woman who was assaulted in 2001. And we still have not found, the person who killed her. But we now have a shelter, for trans women in recovery, that is named after her in her honor. And, there's bed stuff available. A very dear friend, a best friend, and a colleague of mine is working there, right now. And there's a linkage between us where, whoever comes to us, looking for housing and who's currently in recovery, we send them to them. Those who are looking for transgender services outside of the Major Morris House, they bring them to us. But it doesn't stop there, because Philadelphia, I've seen that they've had this habit, if anybody is familiar with the Trans Health Access Project, or TAP, that was, coming into play around 2006. Around that time, the city of Philadelphia was given, just a small amount of money to just go around to the different shelter systems to educate them, about LGBT sensitivity, specifically around transgender issues, because there was this big thing about, what do we do about the transgender in the shelters? As if, it was just some sort of weird thing going on, which it totally wasn't. I was a part of that process, and I got the privilege of talking to these bright, enlightening people working at the shelter system, and talk about a challenging experience. So we were just hoping that us constantly talking to them, constantly giving them pamphlets, constantly having one-on-one conversations with them calling our office, them talking to us about everything, and constantly asking us questions, knowing that we were accessible. We really thought that that was going to change things. But now we have the Major Morris House, and now these other shelters feel as though that, we don't need this anymore because we can just send them here. And that's not the case. The education still needs to be across the board, and these other shelters need to get with the program. So, we're not exactly back where we started, but I just had this feeling that I will be putting back on my sexy little executive outfit to go and talk to these bright, enlightening people working at the shelter system. Yeah. But it was a great effort. People fought long and hard, for the National Mars House to, be brought to fruition and to be, put on the road. And it's here, and it's accessible to people. And so far, the people that have come there and that have been going there, that have been staying there, it's been a great experience. They get to see people like them working there and get to talk to people who are like them and can, relate to the experiences and stuff that they have. And it's just really pushing them to, to pass the word along and inspire other people. So I think it is a wonderful, 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 wonderful thing.
And just to piggyback on that, the story you were telling about the trans access.
Yes.
That's a big deal in Philly that because we have the Fair Practices Ordinance that says transgender people have a right to be treated just like everybody else. If you need to be in a shelter in the city, you have the right to be in the shelter that you feel the most safe in and that matches how you present. And many of the people who do intake for the shelters know that, although not all of them. But for example, if you're a trans woman and you call the women's shelter or you go there during the intake times, most of the staff will know that you have the right to be housed at that shelter and you don't have to be sent to the men's shelter. And that is a good thing for folks in Philly.
Any other questions from the audience?
I'll ask,
From the back.
all the little things that we've been able to like eke out and piece together to make our life ourselves are always really inspiring. And it's really disheartening to talk about the budget, like the big picture and the statewide and the national level stuff. I know it's been like 10 years of cuts to services for all communities, including ours. And we're definitely looking at least another decade, at least, maybe we can turn things around. And so, looking ahead to like another 10 years of defensive battles and trying to like piece together patchwork things, other like leaders in the queer and trans community that you've also been exposed to who have been able to articulate some kind of different vision or different way forward that isn't only trying to pick out pieces of the system that like clearly doesn't care if we live or die. Like, is there any other way forward that you've heard or like visions and inspiring things that you all could put out, or leaders or organizations in Philly or elsewhere?
I'll leave you with this because I kind of can't stay long because I've got a husband and dinner to, regular life, whatever. I will leave you with this. A few years ago, and this is how kind of like the birth of the Trans Health Information Project started. And this is small things, but you can look at this and make it huge. There was no place for the specific part of the LGBT, QIA community, to go to. There were places that they could go, but it couldn't always be respected where they were. There was no voice for them, in our more local government where they could speak about those things and have those things brought up. Two friends of mine sat in a basement and wrote a curriculum, and now here we are. And we're definitely not where we would like to be in reference to kind of changing this world, even here in this small city, but we're definitely not where we were, in the year 2000 or any year before that. I always tell people that I believe in the human race wholeheartedly. And where some of us may have failed in things like humanity and compassion, it is people like us in this room who can come together in our basements or our living rooms or lanais, if anybody in here has one, a breakfast nook, whatever. We can get those things in order and really, really put our minds together, and our monies, our little bit or our lot of monies, or not so little, but kind of so not a lot of monies, we can put all of those things together and start making things work. I think the bigger that we become within ourselves against the powers that be, we can remind them that it is us who has the power. And I think that's where the message has been lost. It is us who has the power to make change. We do not depend on them. They depend on us. They can't take something from us that is rightfully ours. We have the power. So if you have to do it on a street corner, just talking to your friends, and then from that right there grows into this phenomena of resources for everyone across the board, then that is what needs to be done. I encourage that every day where I work. I encourage that every day at home. I tell my husband, I tell my mom. If Rita could get a job, my cat, I tell her. But she depends on me to feed her, and something about her being a cat, and she doesn't speak English. I don't know, but we all have the power to actually make those kind of differences. And I don't want us to be discouraged every time that we see, something else has been cut or another budget has been completely diminished. I don't want people to think that, this is over or this is how it's going to be for the next 10 years or the next 20 years. No, we have the power. We have the power. And I don't know about the rest of you, but I'm willing to die for that change. And I know to some people that sounds a little bit outrageous, but when's the last time you've actually heard someone say that they've been willing to die for the betterment of the people tomorrow? I'm willing to do that. So we have the power. So we need to make that change. We can't depend on them anymore. You have it, she has it, we all have it. So take it and tell them that we just, that we own this. This is our community, these are our children, this is our youth, this is our generation, this is our future. And they can't take that from us.
Once again, all that. No, I mean, absolutely. There's a lot of different organizations, there's a lot of different activists, there's a lot of different people doing a lot of things. But I think the people that excite me most are the kids at the attic. I think they every time I go in there, they're just this light. And if it's not the kids that really want to grow up to do something in this field, it's the kids that just want to grow up to be an example of strong LGBTQ people, and they want to just be an example for other people. I have youth, and there are youth that want to create organizations like the Attic. There are youth who want to create shelters for LGBTQ people when they grow up. There are youth that want to create all sorts of services and nonprofits and for-profits and anything for LGBT people. And I think that, it's been said, 100 times, but the children are the future. And I really think that it doesn't take a lot to be an activist. It doesn't take a lot at all. And I think that making sure that these kids realize how strong they are, and I think that making sure that these kids realize how little it takes to make a difference is really what's important. It's power in numbers. I'm 20 years old. I feel like this whole conversation has been a little over my head at certain times, but I'm here and I'm trying my best to comprehend and keep along and learn new statistics and learn about new organizations and learn about new policies. And I'm doing my best to teach other people my age, younger than me and older than me, how important these things are. And I think the people I work with and the kids that come to the Attic, I think that they're the people that are really going to make a difference in the long run and change these policies and these problems and these problematic laws and these problematic people. That they're really going to fix that.
Yeah, I'm really glad we're being videotaped, because I can't wait to go back and watch it, and because I'm not taking notes, I'm up here, in front of you, but I'm learning some history and I'm learning some different organizations. So, in a way, this is the conversation that you're looking for, partly. We're having some of it. I also think that there's some other awesome organizations outside of Philly. I've always been really inspired by the Philly Over There Law Project in New York. They've done some amazing work around poverty and policing and some great stuff like that. And I'm blanking on the name, but there's been this really amazing movement and documentary about queer and trans people in prisons, and they're going around the country showing this documentary and doing these workshops about, and I think they're pretty much prison abolitionists, and working with queer people to articulate why that's so important, and how, I won't even get into that. But right here in Philly, Decarcerate PA is doing some pretty sort of radical thinking about not just reforming prisons, but getting rid of them. And then this is sort of a plug for a thing that's hot right now nationally, but in Philadelphia we have a syringe exchange. Since that syringe exchange, that's prevention point, that is tips apparent. Since that syringe exchange came in, our injection drug use HIV rates have just gone like that. There's no more inspiring graph on the planet than Philly's injection drug rates. When that happened, it was because of activists who said this must happen. And they convinced Ed Rendell, who was our mayor at the time, that this had to happen. And the governor said to Ed Rendell, if people exchange needles in Philadelphia, they would be in violation of the law. And Ed Rendell said, I'm declaring a state of emergency. It's no longer against the law in Philadelphia. And if you have to arrest anyone, arrest me first. Right? And that was because of the pressure and the facts that was put on him. And our syringe exchange continues to run. There's no federal funding that goes to it, and we've been running. It's 8 cents per needle. We found the money to make that happen because it's cost effective and it saves lives. The last budget cycle, President Obama, well, it wasn't him, it was Congress, said, let's allow federal funding for syringe exchanges for the very first time. And so we had one whole year where you could potentially have used federal funding for syringe exchanges, although no one actually appropriated any money for that, but at least it was legal. And then this year, Congress has put the ban back into the budget. It doesn't make any sense. It's, again, one of those things that's not even good Republican policy. It's just wasting money in order to be mean to people. And so there's a National Day of Action on April 21st, and ACT UP is taking action. But I mean, talk about a system where we're just sort of taking our own lives into our hands and saying, look, we're going to find the money and make syringe exchange happen. And lawmakers are trying to say, no, you can't do that smart, life-saving, cheap thing, right? And we're saying, yeah, you have to let us. There's not a choice. So on the 21st, I think it's at noon at Corbin's office, but I have a bunch of flyers for it, so I'll give them to you all. But if you come out, it will help show them that this means business. 2 news office. 2.
I think is it March 21st or
March 21st? Great.
So this is more a discussion point, I guess, than a question, but Phantazia and I were watching a video earlier today in the office. And I guess because to me the word queer also implies deconstruction and critical thinking a little bit. We were looking at the video through a few different lenses. And one of the things that we were reflecting on is that, so the description of the video on the website was, and I feel like I'm going to talk about this because you guys didn't see it, right? Is a hip and gritty depiction of queer life in the streets. And while that's cute, that's really problematic, right? And life in the attic is oftentimes much more boring than that, you know? And unfortunately, I feel like when we talk about queer youth, like the number one thing, as Phantazia said, at least in the attic, is queer youth voice, right? And voice all the time. And that, unfortunately, not every story is as salacious or intriguing as those stories were. And so it's interesting because I feel like that's often one of our biggest charges, is how to market our cause without exploiting ourselves, right? And so I was just bringing that up as a, I don't know how to phrase that into a question, so I'm bringing that up as a point of thought about how we market ourselves and how we think of our cause and how we give youth voice, but also through things like hip and gritty take voice. So, sorry, that's my question.
I know, like, you guys have been here and taken a lot of time out. So we have the space if people want to stay and discuss, but I also want to thank the panelists for taking your time out tonight to come and talk with us. And if you have to go, you're free to go, but people are also free to stick around